At least 3.37 million Australians live with chronic pain, and often the cause is unknown. Frank injuries, such as body stress injuries like back and neck strain, as well as burns, cuts and bruising, all result in acute pain, which is our body's way of telling us we've had an injury. And after we recover, we stop feeling that pain, usually within 3 months post-injury. CMI focuses on early intervention and the right treatment at the right time to assist injured workers recover from frank injury and acute pain. But chronic pain is different. It's pain that does not resolve and goes on longer than 3 months and can last well beyond the expected time frame for healing, often taking a toll on the worker's quality of life and mental health. Chronic pain is complex and each person experiences it differently, and there's always a reason for chronic pain. It can be a symptom of other disease or it can be a standalone condition. It may show no evidence of its existence and can occur anywhere in the body or at multiple sites. It can involve several forms of pain or just one, and can be daily or recurrent. Chronic pain isn't just caused by the physical injury. Pain is influenced by our attitudes, beliefs, personality and social factors, and can affect our emotional and mental well-being. Chronic pain is real and can be debilitating. Some of the signs of chronic pain include changes in posture, guarded behaviour, withdrawal and anxiety, lack of energy and decreased range of movement. Chronic pain might not be cured by treatment, but it can be managed. So, what can employers do to prevent and manage chronic pain? Firstly, all injuries should be reported to CMI within 48 hours, regardless of how minor it may present. This is because early notification improves return to health and work outcomes by allowing for the appropriate diagnosis, treatment and proactive management of the injury. It's really important that employers support a recovery at work to reduce the risk of chronic pain and also helps the mental health of workers. Secondly, treatment should take on a multidisciplinary approach by engaging the mind and body, not just the physical injury. This is achieved by maintaining frequent and open lines of communication between the worker, employer and treating parties. And in some instances, the use of opioids may be prescribed, but these medications should only be used short-term. Finally, employers should help the worker to stay connected to work. In fact, one of the most important influences on return to work is how supported they feel by their direct manager during the recovery period. By allowing activities to be paced in line with the worker's recovery, we can reduce the risk of them falling into a cycle of overexertion followed by periods of pain and inactivity where they're fine one day and incapacitated the next. Chronic pain is a serious condition, and the more time a worker is away from work, the less likely they are to ever return as they become more focused on the pain and their perceived limitations, often leading to long-term incapacity with negative impacts on the worker's mental health and family life. CMI can assist by facilitating assessments to identify causative factors for a delayed recovery or ongoing incapacity, helping to coordinate access to assessment and treatment relating to secondary conditions due to chronic pain, understanding the worker and their recovery as a whole, coordinating access to reasonable and appropriate treatment, and by collaborating and communicating regularly with all parties to ensure a durable return to work and health outcome. For more information on what you can do to address chronic pain, please contact your account manager or call CMI on 1800 Worker 1800 967 537 today.